Hi everyone, hopefully you can hear me. We're just figuring out how everything works in this room. Thank you so much for joining us. To start, I'd like to acknowledge the various countries and traditional owners of the lands on which we meet. My team's here on Ngunnawal country, and I'd like to pay my respects to elders past and present, and acknowledge continuing connection to land, sea and waterways. And I'd very warmly like to acknowledge and extend that respect to all the Aboriginal and Torres Strait Islander people joining us in the meeting today. So before we begin, my name's Mel Beecroft. I'm currently the Acting Assistant Secretary of the Family, Chronic Disease and Preventative Health Branch in First Nations Health Division. I know that's a mouthful. I'm here with my team in chronic and renal disease, and we look after the integrated team care policy and program. So hopefully you're all in the right place. We're here today to give you a bit of an update about the ITC program and where we are up to. So before we start, I did want to acknowledge that there's been a distinct lack of communication on our part since the review was finalised earlier this year. We have published the review that was done by Ninty One and First Nations Co on our website. So hopefully you've all accessed that. I'm not suggesting that you need to read the entire review. It is very long, but there is a short summary section at the beginning, which I encourage you to have a look at if you haven't already. I want to be really transparent with you today about where we're at, what we're thinking about, and the journey that we need to go on to progress transition to community control. And I want this to be the start of a journey that I'm hoping that we can walk together in terms of transition planning. So this is really an initial informal information session about transition of the integrated team care program to Aboriginal and Torres Strait Islander community control. There'll be some written communications will come out to you probably early next week after this meeting, and there'll be plenty of opportunities for you to engage with the team as we move forward. This session is going to be recorded, so if you have staff members or if you know of people who weren't able to attend today, we'll make the recording available online. I think there will be a small delay for accessibility reasons. We have to do a transcript, which we will do, and we will post online and communicate where it is, so that everyone, including you or anyone that couldn't make it today, can have a look at the recording afterwards, and there'll be a series of written communications on the website as well. So in terms of housekeeping today, you'll be able to ask questions at the end of this session. We'll give you a brief update and a bunch of information up front, and then at the end of the sort of speaking section, you'll be able to ask questions. You can use the Q&A function available in Teams, or if you prefer, you can raise your hand and my team will enable your camera and your microphone so that you can ask your question. There'll be plenty of time at the end to do that. When you see the questions popping up in the Q&A panel, I suggest that you use the upvote function so that if somebody else asks a question that you want answered as well, then you vote, so you tick that one, so that, because we'll start with the most favourite questions first, I think is probably going to be our technique, but there'll be plenty of time for questions at the end, I promise.
Mel, sorry to interrupt.
Yeah, someone's got a question?
I had a question
Right.
from the chat. Someone would like clarification around the review. It was about ITC, mental health, and today's discussion is about ITC only.
Great question. Thank you for asking straight up. Yes. So the short answer is yes, today is just about ITC. The review combined looking at both programs simultaneously so that we didn't come out to you twice. We asked you one set of questions and combined for the review, but in terms of transition, we'll be progressing separately. So this information session's specifically about integrated team care. The mental health and suicide prevention program is also looking to transition to community control and will come out to you separately, either with a webinar or some written communications in the very near future. But today we won't be talking about that program. So I'm going to hand you over to Leanne, who in my team, who is primarily responsible for looking after ITC, and she'll just give you a bit of a summary, I guess, of what the review found in case you haven't had a look, or just to refresh your memory about the review and what it found.
So hi everyone. The department engaged NINT1 in partnership with First Nations Co to conduct this review of the ITC program and also the mental health and suicide prevention for Aboriginal and Torres Strait Islander people program. And as you know, both programs are currently delivered through the PHNs. And this review really aimed to develop options for how the program delivery could be better aligned with the priority reforms under the National Agreement on Closing the Gap, and opportunities in that to build the Aboriginal community controlled sector through investment and capability building. So there were extensive consultations, and I'm hoping a number of you were involved in that. So we included 272 community members. There were 67 key stakeholder interviews, which included Aboriginal and Torres Strait Islander community controlled peak organisations and representatives from all PHNs and the Commonwealth and state and territory government reps. There were 44 focus group discussions, which included 83 ACOs, ARCHES, EMSs and mainstream service providers, 138 survey responses, which included community members, PHNs, service providers and other key stakeholders. And there were co-design yarns held at the end of those consultations in each state and territory and capital city. So what this all amounted to were the recommendations that were put forward to the department. This included 4 key principles which must underpin any effective funding model. So those principles are Aboriginal and/or Torres Strait Islander leadership and community empowerment, a First Nations holistic model, a strengths-based approach, and a culturally safe and accessible system. And ultimately, the report recommended, in terms of the funding models, that a catchment-based funding arrangement with 2 variations, which reflected differing stakeholder views. So those 2 models were either a state and territory model with an Aboriginal and/or Torres Strait Islander community control body at the state and territory level administering the program as the funding body for their state and territory catchment, or a regional model, which is the same at the regional level. So the report notes that the community control bodies administering the funding arrangement may be an established or a new organisation, alliance or consortium funded directly by the department. So, and the designation of these bodies would be informed by community engagement, as well as factors such as capacity, capability and willingness to take on this role. And the report also proposes a transformative effort to move from the current state to future state funding arrangements, and that to be truly effective, these new arrangements should apply to all programs and services designed to improve First Nations people's health and wellbeing. And included in that report was also an option to run an early adopters period, which would allow for organisations to put up their hand and opt in as early adopters to lead the transition. And I'll hand over now to Mel to talk through next steps.
Thanks, Leanne. So the review's quite comprehensive. As I said, it's very long, and it outlines a range of recommendations. I want to say right at the outset that we haven't necessarily agreed to pick up all of those recommendations at this stage. And right at the outset, I wanted to say very clearly that we haven't yet decided on a model for transition. We are 100% committed to transitioning this program to community control, but part of the reason that there's been a delay in terms of us coming to you and talking to you about next steps is that this is a hugely complicated transition, and we really want to get it right. So For context, there's a range of programs being looked at across the department that fund First Nations health programs. The ITC program will be the first national program to be transitioned to community control, which is such a great privilege and honour, but also it means that we don't have an established path or a blueprint to follow. So we're having to figure that out for the first time. And there's a lot of things that we need to take into account. So, for example, some of the things that we need to figure out are, do we use a regional-based approach, a state-based approach, a national approach, or some other model? If we do pick, well, whatever, if we break Australia up into some smaller pieces, whether it be states or regions, how do we do that? Do we keep using the PHN regions, noting that, the PHN regions are sometimes subject to review? How do we make sure that all Aboriginal and Torres Strait Islander people can access services, noting that there's obviously a variation across Australia in terms of the services that people can access? How do we rescope the funding allocations? We've heard loud and clear from many of you that the funding allocations are based on some historical information and haven't necessarily kept pace with not just need, but population growth or growth in chronic disease burden. So how do we make sure that the money is focused on the right places? Do we allocate by need, by population, some other variable? What kind of program model do we need, which will need significant consultation? I want to be really clear that part of the reason we're having this webinar now is that we want to outline to you that we will not be developing a model just amongst our teams and then imposing that on you. We want to work together to come up with the best solution to transition the program in the best way that doesn't compromise service delivery. We also know that we need to retain a fair degree of flexibility in whichever model we choose, because in conversations that we've had with various regions over the last sort of 12 months, what we've learned is that the ITC program actually looks reasonably different across Australia. And I think that's one of the great strengths of this program, is that that you've been able to tailor the program to suit your particular community's needs, the services that you have on offer to make things work in the best possible way. So these are all the complicated bits and pieces that we've been grappling with and trying to figure out how we might proceed. I also wanted to say that the review sets out a very ambitious path forward, which includes establishing new commissioning bodies of some kind. That is absolutely beyond the scope of what we want to do. It's certainly beyond the scope of both the ITC program and the mental health and suicide prevention program. And that is not something that we're looking at doing at this time. So we want to progress with transitioning the ITC program, maintain the principles outlined in the review, which Leanne mentioned earlier, which are about First Nations leadership and community empowerment, a holistic model, strengths-based and culturally safe and accessible. So we absolutely want those to be front and centre, but we don't think that we'll be looking at establishing new commissioning bodies, particularly when there's already so many hugely capable organisations across Australia in the health space. So what we want to do is come back to you to help us come up with a transition plan that works for everyone. And noting that it's reasonably unlikely that we can absolutely satisfy everyone's views, but we need to take into account lots of these complexities and figure out how we might move forward. And we definitely want to involve you in that process. I wanted to also mention that transition to community control goes beyond service delivery. So it means community control leading a commissioning function. So that means conducting a needs analysis for an entire region, commissioning services that can meet those needs, particularly in larger geographical areas. So in some places that, there might be small regions. In other places, we know that the current PHN regions, if that was the model that we chose to pick up, you might need to establish relationships with other organisations in places where an ARCHO's footprint isn't necessarily at one in some places. One of the key things that's missing from the review, which is actually a really critical bit of information for us, is which ARCHOs are interested in taking on this role as a commissioning agent. We have not got that information, and so part of the reason we want to come back out to all the stakeholders is to simply ask that question to begin with: which ARCHOs want to take on this role, and which ARCHOs might be interested in picking up this role but want some investment in some capacity building. And what might that look like? How can we support you to become more ready so that we can transition to community control in your place? So my team's currently working on a timeline, some ideas about a potential model so that we can come out to you. My view is that it's easier for us to come out with a sketch of what we sort of think, so that gives you some grounds to say, well, no, not that bit, or maybe this bit. It gives us something to discuss rather than coming to you with a blank slate. But we want to come to you. So I guess next steps for us will be figuring out how we organise that. There's obviously a lot of you online and a lot of stakeholders in this program. And we want to make sure that we have as comprehensive consultation as possible. So the timeline for transition, consistent with the principles of self-determination, will determine that with the ARCHO sector. And given the complexity that I've just outlined and the absolute necessity that we maintain service continuity for current ITC clients, it's highly unlikely that transition will occur prior to 1st of July 2026. So in saying that, I want to talk about future funding. So we're very aware of the fact that the current funding for ITC concludes on 30th of June 2025. I want to be very clear to say that the timeline for funding and the timeline for transition are not necessarily linked. So while the funding runs out, the current funding runs out on 30th of June 2025, that does not signal that transition will happen from the next day. I think, as I've outlined, the complexity of this program means that we will need some time to work through what needs to happen next. I wanted to let you know that we're currently seeking a 12-month extension from government. We're yet to receive approval, but that's something that we've been pursuing for some months now. And as soon as we know, you will know, because as soon as possible, we want to be able to give you some assurance that you at least have an additional 12 months of funding certainty. I know that's not ideal. We're very aware of short-term funding agreements create huge admin burdens for you all, create some difficulties in terms of retention of staff, contracting arrangements and a whole range of things. Let me assure you that it absolutely doesn't suit us either to have these short-term arrangements because every time we go into these things, there's a lot of back-end stuff happening in the department too. We would much prefer to give you longer. But I guess what we're trying to do is balance our desire to make a commitment to you and to so that you can make a commitment to your staff with the principle and the idea that and the commitment, I guess, that we want to transition to community control. So we need to balance those two things, which is difficult. I'm certainly not suggesting we've got it 100% right, but that's some of the context in terms of why there's these sort of 12-month funding arrangements at this time. It's my hope that as we transition, we'll be able to resume longer funding periods, but I guess that's something that we'll have to work out over the course of transition. I think that might be it for me. I might hand over to you. If you want to ask a question, I can see Tony has raised his hand. My team will manage that bit. I'll do my best. I'll 100% be as honest as I can be. There's no point in me keeping secrets from you or not being open and transparent. But I encourage you to ask and use the upvoting buttons if people are typing in the Q&A session. And I understand you can type anonymously if that's something you choose to do, which is absolutely great. So I'll let I've got Casey and Cass here ably assisting me with the with the question function.
Tony, can you please check that you don't have yourself on mute? In the interim, we do have a couple of questions here. One of them is from yourself, Tony, and Tony's asked, is there a time frame for when the new developed model needs to be in place?
I don't think there's anything. We want to transition at the right pace. We don't want to do anything too quickly because we don't want to overwhelm anyone. And we're very aware of, the workload of ARTROs in particular. So we want to balance the need to not transition too fast we absolutely don't want to go too slow because we want things to happen. I think we're all on the same page. We all want to transition to community control. It's just a matter of getting that right. So there's not really an end date, but I would hope that we'd be starting to transition, or maybe we will pick up the early adopters idea out of the review, which means that some services hopefully will start transition from 1st of July 2026. That's my hope, is that will happen. That certainly won't be across the board, and I expect that there'll be some kind of phased or staged rollout, if that makes sense. That's depending on what you all tell us needs to happen, and to be honest, how many ARTROs want to put up their hand to say that they want to take on a commissioning role and be direct funded. Hopefully that answers that, Tony. If not, please ask a follow-up question.
Is there anything else you'd like to add there, Tony? We have a question here around, is there an option for regions to determine what their funding arrangements can be?
I think if I get that, I think that's saying, is there flexibility per different regions? I think we want to have a consistent model across Australia. That's not saying that things will look exactly the same in every place. So I think this question is suggesting, so for the purposes of illustration, and absolutely this is not a decision that we've made, but for the purposes of this question, let's say that together we decide we want to go with a regional model. I expect, and again, I don't know because I need to test this with you, but I expect that things might look a little bit different in different regions. I expect that in some places there might be an Aboriginal and Torres Strait Islander community control organisation that wants to put up their hand and, commission a bunch of services across their region. And that's, an easy, because an organisation already exists, may have played that role before or may play that role in other programs. In some places, I expect it might look a bit like a consortium arrangement where maybe there's a lead organisation or maybe there's some support from some organisations, maybe. In other places, things might not be so easy. We might do some capacity building. And to be honest, I'm really open to the fact that in some places, if things are working really well, then we're definitely open to keeping the status quo if that's what all parties in that particular place, whether it be a region or a state, if everyone wants to keep things as are, we're actually really open to that as well. It would depend on the views of people in that place. And when I say place, I mean however it is that we've decided to break up Australia. Because again, we need national coverage, but I expect that things will look quite different in different places. And I mean, that's to be expected, I guess, because there's different coverage of art shows across Australia. So I would expect that that would be reflected in the different models.
Joanne Ryder, you've raised your hand. Would you like to unmute yourself and ask a question?
Yeah, sure. Can you hear me?
Yeah, great. Hi, Joanne.
Okay. Hello. I just wanted to ask, are you aware in the Knitting One report that the number of Aboriginal people in Perth Metro and Kimberley is wrong? If you're going to do funding based on how many numbers there are, I know my CEO Annie has raised it to different people, so I'm not sure if you're aware or not. But if you're going to do funding based on numbers.
Awesome point, and thank you for bringing that to our attention. I don't think that's something that we were aware of, that the report contained incorrect numbers, but absolutely, Joanne, we will be doing it. If we're refiguring out the funding distribution based on population, it won't be whatever's in the report. We'll be getting our own advice and numbers from, I don't know, the ABS or somebody in a bit more of an official capacity to make that work properly, so that we've got the best possible information to make the best and most accurate estimates that we can. But that's really great. Thank you for letting us know.
Thank you.
Thanks, Joanne. We have a question here from Matt Dixon. Is there thinking yet about what will happen with the element of ITC that focuses on culturally competent mainstream services, ICT2 and PHN in the future role?
Yeah, and I think that's a great question, because that's one of the complicating factors that I didn't even raise. There are a few bits and pieces related to ITC that I don't know how that will work. And so it may be that the commissioning organisation as an art show wants to play that role and provide cultural safety training or outreach to mainstream providers. That may not be the case, so there might be a role for the PHNs or some other organisation. There's also the data components that we know PHNs have access to a range of data, which is awesome. Art shows don't have access to that at the moment, and so we need to figure out how that might work as well. So there are a couple of smaller and yet very complicated things that we have to work out.
Tony, would you like to ask a question?
I think you should be able to take yourself off mute, is that right?
Yeah.
We can't hear you, Tony.
Tony, we'll try and come back to you. Kristen Seymour, would you like to ask your question?
Thanks, Lee.
Oh,
Hi. It's
Tony?
actually Lee. But Lee and Kristen are on the same one.
Oh,
I
Lee
just
and
wanted...
Kristen are on the same.
Yeah. No, it's okay. It's all right. Just a very quick question. What would be the process for an art show to actually express interest in taking on a commissioning like role? So what would that process look like?
So that's something that we've done a bit of early investigating about. It may be some of the things that we're tossing around are something like an expression of interest process, where you would essentially submit quite an abridged, I think, application of sorts. It's not really a full application, but really a hand-raising exercise to say, hey, how about me? And so it might be an expression of interest process so that then we could run a targeted grant opportunity. So we haven't figured that bit out yet, but that's something that we've been talking to our grants team a little bit about, how we can collect that information in the best possible way and publicise that in the best possible way, so that everyone is aware and nobody misses the opportunity to put their hand up. That will absolutely not happen. We will do everything in our power to make sure that there's, huge lead time so that everybody knows when the time will come. In the interim, if you know for certain, Lee, that you want to put up your hand or the hand of your archo, then very happy for you to drop us a line and let us know that.
Thank you.
Thank you, Lee. Tony Crossley. Just a reminder, Tony, to unmute yourself. We might come back to you, Tony.
I know this is a learning curve for all of us.
BC Bathurst.
BC Bathurst.
Would like to ask
Hi,
a question?
everybody. It's Donna Stanley.
Hi, Donna.
We're a group of us in the room here. I guess my question, there's a bit of a statement that goes before it, and it talks about the capacity of Aboriginal community child health services. That there are variances across, well, in our region there are 12. Some have much higher functionality than others. And again, we also have the challenge of them being entities in their own right. So they can't necessarily tell each other what to do. And I guess, again, we're looking at trying to apply a white system across an Aboriginal lands, if that makes sense.
It does make sense.
And it also, there's then a power imbalance if, one organisation's got the role of commissioning those dollars. How does it impact those other not less functioning, but less capacity, I suppose?
Yeah.
I'd be interested to know how that's going to actually be managed. I know that, Western Queensland have got a great model up there. It's highlighted obviously in the report.
Yeah.
I don't know, do we take some of that learning and try to apply it in spaces? I think it's some of that stuff. But again, why would we do a report or undertake that report if we're not going to follow those recommendations? Because there were obviously quite a lot of Aboriginal people who inputted to that.
Absolutely.
So I guess my question is, why have that report and then decide not to follow some of the recommendations? And, are we going to be privy to what recommendations will be followed?
Absolutely, Donna. I'm 100%. We're 100% committed to transparency. The recommendations that we absolutely do want to pick up are those principles. We 100% wholeheartedly want to take those on, and I think that's how we're trying to do business here in First Nations Health Division anyway. The reason that we don't want to pick up the recommendation in the report of a full transformation, I guess, and the creation of new commissioning bodies is essentially it's just beyond the scope of these two programs. There is an appetite at the moment in the department or in the government to create huge new commissioning bodies across Australia. And
I was just going to also ask about, obviously there's regional alliances, there's local decision-making mechanisms through, the Commonwealth and the Commonwealth and the state government.
Yeah.
CAPO, for instance, in New South Wales, but also at a national level. How is that considered in relation to this process? Is it included in that or not?
That's some of the complexity. That's one of the challenges for us is figuring out, because as you say, in some parts of Australia, it's less complex than in others. It's a bit more straightforward. Certainly in Western New South Wales, it's a vast area, so there is a lot of organisations and boundaries and communities and a whole range of things to take into account. And I guess that's part of the reason that we haven't just gone away and come up with a model that we want to stick on top of you. We want to work with you so that we can figure out what might work in Western New South Wales and what might work in, Western Queensland, which are obviously very different. But we've got one program, we've got one bucket of money, and we need to come up with a solution that works for you both. And so we want it to be sufficiently flexible to make that happen. One thing I do want to say is that we what we don't want to happen, and this is part of the reason why we need your help, is we don't want to have a model that means that particularly art shows are competing against each other and there's that power imbalance or power struggle, as you've mentioned. That's definitely not what we want to happen. We're obviously not aware of all of the complexities of relationships between organisations, but we don't want to make things more complicated than they are already on the ground. And so in places where the footprint might cover a huge range of art shows, we need your advice about how we can make that work in a way that works for all the art shows, some of which, as you say, will immediately have capacity to take on a commissioning role, and others have less capacity or less desire to take this on. We don't want to be in a position where we're saying to all art shows, you must take this on. That's the idea of community control, right? You decide what you want to take on, and we want to respect that. If you don't want to take on a commissioning role, that's fine. But we need to work with you and other organisations in your place to figure out how ITC might work in that event.
I guess the other really important question too is around, I know there was a question in the chat about mainstream space. If you look in New South Wales, only 30% of Aboriginal people go to an AMS.
Yeah.
So we need to make sure there's a very strong focus on how that gets conveyed or transferred across the mainstream sector.
And I think that's one of the complexities too that I didn't call out, is that because this is a program for all Aboriginal and Torres Strait Islander people with chronic disease, there needs to be a mainstream element, because as you say, in lots of places, lots of Aboriginal and Torres Strait Islander people access their healthcare through a mainstream service. And so we need to make sure that those people are still able to access ITC. Even if funding goes to art shows, there needs to be some mainstream elements somehow woven into this mix, again, which looks quite different in different places. Well, but absolutely, mainstream's not.
All our money in Western goes to Aboriginal community controlled health services, and we are starting to build some good resource and some, I guess, we've had a go at putting together a community of practice. So we're very happy to share some of that and start to think about what that looks like in terms of transition. So, yeah.
That's great. And I think we want to build on what's already happening. We know that there are things like communities of practice in some PHN regions. We know that there's been a lot of forward thinking in preparation for transition. We don't want to smash all that down and start again. We want to figure out a system that builds on what's already happening. And so again, it's quite complicated because what's happening for you is quite different to what's happening in a place that's in Tasmania or New South Wales or or in the metro area.
Thank you.
But yes, all of those things are really high on our list.
Thank you, Donna and team. Just like to go to a question here that was posted anonymously.
Mm-hmm.
Will the scope be gazetted archers only? Could non-NACHO affiliated but community-led health organisations be included under the new model?
Absolutely. That is, as I've just sort of talked about a little bit, there's not necessarily an art show in every place across Australia. And I suspect that in every place in Australia, art shows might not want to take on this role or might not have the capacity to take on this role. And so other Aboriginal community control organisations, I expect, will be part of this, part of the model, absolutely.
Can I come back to Karen Ingham?
Oh, hi, can you hear me?
Oh, hi, Karen.
Hello. I'm joining from Wiradjuri country, and I just want to thank you for pulling us all together to yarn about ITC. I work for Marathon Health, we're a mainstream organisation, been delivering ITC since 2016. And yeah, I think my understanding, because I did attend the review face-to-face in Sydney, that I think we're a little bit unique in the way the Murrumbidgee Primary Health Network has set ITC up to ensure that people have access. For me, it's about choice and just ensuring that people have the freedom of choice to where they choose to go for their healthcare and be able to access ITC. I guess I just wondered what is the vision, or how do you envision this working if you know, if, for instance, in the Murrumbidgee, the ARCHOs here, we've got 3 AMSs in our region. So I just wondered, like, how you envision that working, and also considering that some ARCHOs do require confirmation of Aboriginality.
Yes. I know that can be an issue for lots of Aboriginal and Torres Strait Islander people, and that's not some kind of stress that we want to put on anybody. I think you've hit the nail on exactly the complexity of what we're talking about. I'm glad you said the word choice. We're really interested and hoping to maintain choice and control for Aboriginal and Torres Strait Islander people that can access their healthcare where they choose. That's absolutely their right. And in places where lots of Aboriginal and Torres Strait Islander people access mainstream services, we know that there needs to be a mainstream component to the model in that place. And I expect that is the case for lots of places in Australia. Where my team's currently looking at how we might define what a commissioning role looks like, and how that might work in terms of making sure that in places where there's mainstream options, that they're included in the model. That might look different, so it might mean like a subcontracting arrangement, it might mean like an outsourcing, or, you know, some kind of contractual agreement. It might mean outposting. I'm not entirely sure, but depending on what others in your region or in your state, whichever model we choose, you know, things may look similar to how they look. They might, you know, evolve completely differently. What we're hoping, though, is that for end users, so for clients of ITC, that they can't really notice a lot of difference. They might be accessing services from a different provider, say, but we don't want there to be any gap, or certainly we don't want to introduce new barriers for them to access their care. That's why this program exists. So it may be, you know, for a whole range of reasons, some providers might shift around. I don't know about in Murrumbidgee specifically, but absolutely maintaining mainstream is really important to us.
Thank you for that.
No worries.
Thank you, Karen. Andrew Newton has a question. We're sticking on the topic of commissioning. He's asked, is there still a potential for PHNs to partner in the commissioning of services? He's commented that this would provide continuity of services and care and use the PHN expertise in this area.
Absolutely. And certainly if in a place, if the PHNs are partnering with ARCHOs, I absolutely can't see that would be an issue. As I said, we want to maintain some flexibility, and we expect that PHNs are still involved in some way or another in most places in Australia. In some places, ARCHOs might take the role entirely, but as I said, there is still some complex issues that we're not quite sure how to tackle yet, including things like the cultural safety or cultural awareness component for mainstream, and the data component for the program. So there may be an enduring role for PHNs in that space. It may be broader than that, but absolutely it's definitely not off the table.
Another question here. Do these funding changes proposed have bipartisan support? Are they likely to change again with a change of government?
So in terms of funding changes, it's really It's it's a funding change insofar as it's a change in who we're funding. I can't see that I mean, the ITC program's been running for a long time across different governments, and I can't see that changing. And certainly we have a commitment to the ITC program. We know how many people it supports and how many people it helps. So in terms of the ITC program itself, a change in government, should that be the case, won't make any difference. This is really the shift to community control is really about the arrangements that we use to fund organisations, and absolutely, we've been speaking across our department. It's happening, lots of people are talking about it, and that's not an issue that's been raised as a risk. So I can't see an impending federal election having any impact on our rollout of transition to community control.
Jenny Somerville.
Yes, hello.
Hi, Jenny.
Hey, how are you?
Good, thanks.
Listen, I was just wondering if an ARCHO did put up their hand to take on a commissioning role, would that include, and I suppose my concern is around the resourcing that's required to actually perform that function, and I appreciate we're starting small, but it's effectively a much bigger cost even to administer something quite small like ITC.
Yep.
So would that be considered in the equation?
Absolutely. We know we have to figure out an administrative component for taking on extra work, because you can't do this with your existing footprint, because your staff can't do more for free. We know that there will have to be extra staff, so there will be, that's one of our key considerations, is how can we build in an administrative component that doesn't mean that the number of clients that you can take on will be affected. So that, instead of giving you the same, but you're now doing more, we're hoping to be able to give you more so that you can do the same. Does that make sense?
Say that again, sorry. One more time.
Instead of giving you the same amount and asking you to do more with the same amount of money, like take on all the administration of doing commissioning, we hope to be able to give you more so that the end number of clients that you can take on isn't affected.
Yeah, okay, great, thank you.
That's our great hope, but certainly to increase the value of the ITC program, that requires government decision. So, we're at the mercy of budgets and things.
Yeah, absolutely. And in that mix of things, I suppose the other thing that ITC does not cover our jurisdiction at the moment.
In that the funding's insufficient, Jenny? Is that what you mean? It's insufficient,
yeah. It just doesn't cover all the areas. So I suppose that would be the other thing to consider in any budget submissions in the future.
Absolutely. We hear that a lot, Jenny, is that we're not giving you enough money, that not just are we not splitting it up in the right ways, but that the money isn't keeping pace with the number of clients or the complexity of their chronic disease. Yeah. And that's definitely something that we hope to be able to address. I will say this is an $80 million a year program. We would love to increase to meet demand. But obviously we're subject to government decision and a whole range of budget pressures and things. So I can't promise you that, but absolutely it's something that we're, consistently asking for. And we're hoping to do a bit of modelling and things to figure out if we had an unlimited bucket, how much would it cost to meet need? That's one of the things that we're hoping to get a bit more intel about.
Great, thank you.
Thanks, Jenny.
Tony Crossley. Tony, just a reminder to,
We're right now.
Hello.
We've got a friend
we
who
can
can help
hear
us. Hi, my name's Des Cooper. I've just got a question that's already been answered. It was more around with the commissioning with the ARCHO. we're in a region where there's 3 AMSs. PHN funds all 3 of those AMSs. What would happen in a case where perhaps one AMS did put their hand up for that,
Yep.
and the other 2 AMSs are still funded by PHN? How would that pan out? Like, I'm trying to do it not so it's so political here.
No, I get it. It may be that instead of the money going from the PHN and split out to the 3 art shows, that's the current model? Is that?
Yep.
And I don't know if there's some mainstream components there too. Let's say there is.
Yep.
I don't know. It may be that one art show takes on the commissioning role and is the central source of funds, and then splits that money across the other art shows and other mainstream providers as the commissioning agent. They may also provide some services, or there may be some other arrangement, but we'd be hoping to not, as I mentioned to Donna before, what we're hoping not to do is to create competition between art shows, and that's difficult for us. Where there's, in some places, there's clear, not a consortium, but some sharing and partnership arrangements already established between art shows, and so that model might work if that was the case. If there's a case that that's not happening, then we need to figure out how we can, if we did award, pick essentially say one art show as the commissioner, I'll call them, then how we can do that in such a way that it doesn't create politics or tension, conflict in that region, because we don't want to create a power imbalance, essentially.
And also around that too. So all 3 of us service different areas.
Yep.
All 3 of us have different number of patients. And like we were talking before, with the ITC program, it is the patient's choice as to where they want to go. If we had a higher number of clients than another AMS, and would it look that those patients would have to transition to that AMS if they weren't there before? Like, these are sort of, I suppose, things we have to look at.
Yeah, these are this is why it's so hard.
This
is why, in some ways, like if we could have come up and solved all of these problems ourselves, maybe we would have, but every time we talk to another place, there's an extra set of complicating issues about populations and service, who looks after which bit of the community and who goes to which AMS, and what's the relationships between AMSs. And so I think every time we look at different parts of Australia, we're hit with these questions that then get added onto our list of, here's another challenge that we have to overcome so that we don't make things worse. What we want to do is satisfy the government's commitment to closing the gap and to strengthen and support the Aboriginal community controlled sector. What we don't want to do is put extra pressure or create conflict within that sector. And so we have to figure out a way that we can do the first bit without the second bit. And that's why we want to enlist your help, and we absolutely can't do this by ourselves, or we can't even do this by talking to, 1 or 2 art shows or 1 or 2 PHN regions, because what's happening in where you are is very different to what's happening in other places.
And that's true. And also, just my last question, if it was commissioned to an art show in our region, what would happen to the PHN for that region?
PHNs are funded to provide a range of programs, like above and beyond ITC,
So
and that will
ITC.
continue.
Yeah.
That will continue. There's no, and they provide a whole range of services. What we're looking at in this instance is ITC alone.
Yeah. Okay.
So
I have one-
PHNs still exist.
I just have one quick question, and it's just off topic, but I've been hearing all of these people from all over Australia and stuff. Is there somewhere we can go where there is a list of all the ITCs in Australia? Because we have mob that move around to all different places all the time, and we'd like to be able to connect them with the ITC that's got wherever they're moving
Great
to.
question. That's an awesome question. I don't know the answer. I don't know if we know the answer.
We don't have a centralised public list of like all the commission services. We do get that from our reporting, so it's something we could look at. I mean, at the moment, the best advice is to advise a client to contact that PHN region, the PHN, and they'll be able to point them to the service they can access. But we can also look at another way of doing it.
Yeah,
I think that's
when we can sort of give a little bit of a handover, you know, to the next.
Yeah.
to the next place.
ITC,
Yeah, to the next.
Yeah, just
I
good
think
to be able
that's
to
a
have
great
those
idea.
contexts, that's all.
I
Yeah.
just have a quick
And I
question
think
to,
for transparency and things, that's a great, I mean, that's something that government's asked a lot. Where's the money? To which organisations are getting the money? And I think that's definitely something that we can add to our list of things to think
Yeah, it'd just
about.
be nice to have a list of where all the other ITCs are, what regions they're in, just so we can, you know, let our patients know and different
Of
things.
course.
And we can contact them for other things we might need. Thank you.
Yeah, or get support or advice about a complex
Yeah,
problem
that's
that you
right.
haven't encountered before or whatever. I think
Yeah.
that makes perfect sense to me. So we will definitely think about that.
Yeah.
Absolutely.
I mean, alternatively, you can reach out to us as well.
Yeah.
I just have one more question. With other ITC programs, do we all use the same database, or like we use MMEX? I know that
No.
database. No. Okay.
No, so different art shows use different patient management software.
Yeah.
And I think that different PHNs use different platforms to collect information from you. Is that right?
Yeah.
Yeah.
And it
Sure.
changes all the time.
And it changes all the time, which actually is quite challenging for us too, because we don't get consistent like information across PHNs. And I think so I think that's part of the challenge. I'm not sure if any of that's being picked up in the PHN review. I don't know. But that again is another challenge in terms of reporting and collection of information.
Thank you.
Thank you.
Thank you.
Just mindful of the time, we still have quite a number of people wanting to ask questions. Just like to ask everyone to pop those questions in the Q&A chat function. We're going to take down those questions and get back to you with answers to all of your queries. And I'll just hand that over to you now.
What I was going to say is, so any questions that we don't answer today, we will undertake to provide some written responses. We have got ready to go, but we'll amend it after this meeting. So as I said, for early next week, a list of frequently asked questions, and so some of them might be repeated. We'll send that out and it'll be published on the web, again, so that there's an enduring record of what we've talked about. Do we want to go to Tony's question as a final question? Or, can Tony?
No, I don't think Tony.
Oh, it doesn't have a question.
So we're
Right on time. So this is not your last opportunity to ask questions. Absolutely not. So as I said, we will answer the questions that we've got that we haven't been able to get to. If you have other things that you really want us to know or that you want to ask, please reach out. You know who we are now. You've got our contact details. You should be able to email the address that sent you this invite. Obviously, if we get hundreds of questions, please bear with us as we get through them. But the next steps from here are that my team will figure out how we can come to you in the best, most efficient kind of way, so that we can start to have some of these conversations that I've mentioned at the beginning of this meeting, and so that we can come up with a model that suits us as many people as it possibly can. So that will obviously be in the new year. So that's it for us for today. I did want to say thank you so much for coming. You'll be able to access everything online in the very near future. But in the meantime, I hope that all of you have the opportunity to have a break over Christmas and have a happy and safe Christmas and a good break. We'll talk to you again soon. Thanks.